Alternative treatment has always been received with some level of skepticism. Homeopathic treatment, however, has been around for decades. Today, we're here at Endpoint Homeopathic Clinic to find out more about the topic.
Homeopathy is a branch of medicine that deals with the causes of problem. With that, I'm trying to say that let me use a typical example like a disease like diabetes. When you walk into Kolebu, the doctor will check the sugar level. After realizing the sugar level is very high, he will decide whether to put you on insulin, Dowlen or metformin. And that does the management. It will do the management till you are no more in existence. But with homeopathy, what we do basically is that we will have to find out what is causing the sugar level to rise. And that is where we have to go to know the cause of the problem. Assuming after realizing we got to know that there's what we call pancreas. Okay, and then we realize that the pancreas is the one that is not working well. And for that matter, the sugar level is rising. What the homeopath or what Endpoint Homeopathic Clinic will simply do is to make sure that we give medication to be able to correct the pancreas.
So then, in short, homeopathy does not manage, it deals with the what?
Root cause of the problem. It deals with the root cause of the problem.
How do you treat high blood pressure with homeopathy?
With homeopathy, so when somebody walks into our OPD, first of all, the pressure will be taken, just as the orthodox do with the pressure apparatus. After getting to know whether the pressure is high, let's say the reading shows that the person is 150, 100, or let's say 100, or let's say 180, 120. Okay, we do not take that as a final reading because we believe that there are so many factors that may come to play when somebody's pressure is high. You see, because unlike the orthodox, with homeopathy, it says that every individual, not even identical twins, are the same. So you may have two or more people with the same reading, but we shouldn't forget that we have different sexes. We have different sex. You can be, one could be a female, one could be a male, and then there are different activities that one engages in. It depends on the kind of food one takes, the kind of work we are all engaging and all that. So all these things will have to come to play. So when we realize that it is high, what is causing the pressure to rise?
So meaning you don't only rely on checking the person's pressure to determine whether they have high blood pressure or not.
We go further because sometimes somebody may even walk. You understand? Somebody might have not slept very well the next day. So when you check the person's pressure, you are likely to get the pressure not being the actual reading. So homeopathy, we rely on the blood sample. There is something in the blood, what we call fundamental ray, which is quite technical. With the machine will be able to pick the right pressure from that ray. What I have to do simply is to take the blood sample, just as any orthodox doctor will do. So with this, you place this here. That is the plate to diagnose with. This is the pendulum. The pendulum is going to show you the reading. It's the pendulum that shows you the reading. Okay, so it depends. You should know your reading. That is, if it is clockwise, then it's positive. If it is anti-clockwise, that could be negative. If it is neutral, that means that problem is not there. One thing about homeopathy is that we don't prepare somebody's medication down before the person comes to the hospital. The strength of medicine that you are going to take is going to be different from that of mine. Okay. So we need to find out the strength. Okay, so this is my placebo. Okay, you just pour this placebo. It can be glucose or it can be tabs, and this is unmedicated, and this is certified by Food and Drug Board. This is what we buy from them. Okay, so with this one, now you're going to, what we do is potentization. We use the same machine to find out the kind of medicine that will be good for you alone, and then the strength. That was what we call potencies. Your strength. You fit this one here, and then all you want. I'm looking for Camia, a medication, and this their botanical names. I would say that homeopathy is an improved form of herbal medicine, because when you want to get this thing, you could get this one, the source from plants, edible plants. Instead of you to go to the farm, get that leaves, you're going to use a medium, okay, and the medium could be these taps, or it could be any sterilized water or bottled water. Okay, so I'm going to transfer the oat into this machine, into this placebo
By radiation.
Yes, by that. Okay, so I do that, and then that's how it goes. This machine is this one is very sophisticated. This is about 10 seconds, and then I'm through.
It's done.
It's done.
So my medication is ready.
Yes, it's ready. The color do not change, nothing changes, but there's that strength in it.
So now I take this and I get the effect.
You get the effect that you are supposed to get. Just like somebody going to the forest, getting the root and so on and so forth, coming to boil and everything. This one, you don't do that. You only have to potentize it.
Shouldn't we be worried about side effects?
You see, it depends on the kind of the radiation that we are talking about. This is just the vital force. No side effect at all. Assuming if I don't use the right sterilized water, or if this placebo, this type of glucose has not been certified by the Food and Drug Board, and we are using it, that is where you could have problem. But once it's been satisfied, meaning that it's unmedicated at all, there's nothing in it at all, or even if it's juice you want to use, if it is orange you want to use, then you have to neutralize the strength of it.
Can I also just walk in and say I want maybe a full body diagnostics? Is that possible?
Yeah, it is possible. Assuming the person is an emergency and you want to be able to, save the person and know what is exactly wrong with that person, you can use this analyzer. Just type the person's name, the person's sex, date of birth, height, weight, and so on and so forth, what we call the vital stacks, and then you save that, and then there's a link here that scans the whole system. So you just have this testing. This can scan from your head to your toe.
Scanning organs and everything, you mean?
Yes. Any organ that is it scans, it brings that picture out there. If it is your liver, if it's your kidney, if it's the gastrointestinal, the cardiovascular, it scans the whole system.
Using radiation?
Yeah, yes, this one is a magnetic analyzer. It's just like a magnet. Okay, it's a magnetic analyzer that scans the whole system. Within a matter of 2 minutes, it's through with a scan. So after getting the picture about the whole thing, seeing that okay, the cholesterol is high, and then the heart is not working well and all that, then we can take the sample as we did, put the sample again over there, and then the sample will find out, because if it's the heart, which part of the heart is not working well. And then we use this one, having the idea about it, we take the sample and then we confirm from the radionic, and then based on that we are able to prepare medication for the patient. So with homeopathy, without diagnosis, you can never give the person anything at all. So that is the differences between the herbal and then the orthodox.
So now let's go take a look at the scan room as well. Okay, so with all of these, how much are we looking at spending when it comes to homeopathic treatment?
If you look at our diagnosis, it's quite reasonable. That is from, let's say, it ranges from 20 to 120 Ghana cedis.
For a full diagnosis?
If it is full diagnosis, including the scan and everything, that is about 200 cedis.
Okay.
Full diagnosis, that's from your head to your toe, with ultrascan and everything. Check if you are a male, you are checking the prostate, you are checking the urethra and everything, the kidney and everything. The whole diagnosis is about 200 Ghana cedis. We spread it within the time frame, because most of the time homeopathy happens to be the last resort for people. They might have been to other places, other hospitals and other things, and then once they are unable to get the result that they want, that is why we call alternative. Because already the person might have spent so much So you tell the person that when you realize that you are seeing changes in the condition, assuming you are not having your menses for 3 years or this thing, if you start seeing, even if you start taking the medication, within
you start seeing
any change,
then
you can start paying the money in installment basis.
As we've heard, homeopathic treatment is quite affordable. It relies heavily on technology. So let's go find out about some of the machines or facilities that facilitate homeopathic treatment. We're here in the physiotherapy room with Dr. Opuni Befi, who is actually going to explain to us how some of these machines work. So, Doc, please, what exactly is going on here at the moment?
Yeah, this is the neck and shoulder massager. This radiates through from the neck to the waist. It massages the neck, the waist, the neck, the shoulder, and the waist. So if you have any pains in the neck, the shoulder, and the waist, this machine takes care of it.
So are there specific conditions that are referred to these machines?
There are no specific conditions, but people with pains that radiates from the neck to the waist, we advise these machines for them. We recommend these machines for them.
Okay, so obviously these machines facilitate treatment. Now, is this a normal ward bed?
No, this is the Sarajin bed. This is a Sarajin bed. It massages the whole body. It removes toxins from the body. It's massaging the whole body. So it's from the neck to the legs. So it massages and radiates through the vertebral column, I mean the spinal column. So people with problems with spinal columns, people with problems with the nerves, we use this machine. So I mean people with stroke patients specifically, we use these machines for them.
Does it correct the condition, or what does it do exactly?
It doesn't correct the condition, but it facilitates the treatment. It speeds up the treatment. But the remedies or the drugs that we give, the medications, correct the fault or the problem.
Okay, so taking this young man here as an example, I don't know exactly what his condition is, but let's assume that he has got a stroke. What impact is being on this machine going to have on him?
Yeah, when you have stroke, we have so many causes of stroke. Depending on the cause of the stroke, let's say it's because the nerves are not working properly, or the person has problem with the spinal column. Now this machine radiates or it massages the spine from the neck, the spine to the legs. So when the machine rolls, there's something inside we call a roller. So when it massages from the neck, the waist, the vertebral column to the neck, that means it's correcting the mistakes there. When maybe there is an opening in the vertebral column, I mean the spinal column, then it closes up the gap. Then when we give the medications, it will help the treatment.
So how long will such a patient be on this bed?
Okay, with the physiotherapy, you are supposed to come twice every week. And the treatment will be, let's say, from 5 months, and you are off.
Okay, but wait, how many minutes are you required to stay on the bed?
30 minutes.
30 minutes. Okay, let me quickly get to the patients we saw in the... You said this is the shoulder and neck and back massager. Madam, how are you feeling right now?
I'm getting better with this neck and the back massage.
Okay.
First, I was having a back pain at my back and I cannot bend properly. But now with this machine, I'm able to bend and do all sort of bend and kneeling.
Okay. But how long have you been using this machine?
I started around May, so it's roughly 3 months or 4 months.
It's been interesting so far. Obviously, the option of alternative medicine is one that you can consider.